we are so pleased that so many of you have come to start our fall series. And today, I'm so glad that you remembered to come to our festival. Marked it on your calendar. As I was getting ready today, and I went into the room, and I couldn't remember what I'd gone for, so I had to back out and cue myself up again, and then get into the room and remember. So a lot of these memory issues are perhaps things that we're experiencing, but I know that a lot of you might be caregivers for your parents or spouses that might be having memory issues. And so we are very pleased today to have Dr. Robert Santulli come and talk to us about the memory issues and tell us about normal memory problems and then those that we might really need to be concerned about that might indicate a more serious problem. Dr. Santulli received his BA degree from Yale University and his MD from Columbia University College of Physicians and Surgeons. He completed his psychiatric residency at Columbia Presbyterian Medical Center in New York City and psychiatric fellowship at the New York Hospital. Currently, Dr. Santulli is Associate Professor of Psychiatry at Dartmouth Medical School and Director of the Memory Disorders Program at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. Dr. Santulli serves as psychiatric consultant to a number of nursing homes, assisted living facilities, and retirement communities throughout New Hampshire and Vermont. His special interests include Alzheimer's disease and the treatment of mood and behavioral disorders in dementia. Dr. Santulli is board certified in psychiatry, geriatric psychiatry, and hospice and palliative medicine, and is a distinguished fellow of the American Psychiatric Association. Dr. Santulli is the past president of the Alzheimer's Association of Vermont and New Hampshire, and he's the founder and director of the Upper Valley Alzheimer's Disease Resource Center. I'd like to welcome Dr. Robert Santulli.
Thank you very much, and welcome to you all. I'm pleased to be here and part of this first OSHR presentation. As was mentioned, this is going on in a number of locations around the state, and I'm glad to say I'll be going up to Newport for this same presentation. So if you can't remember what I say and you want to hear it again in November, I'll be up in Newport. The topic is memory, aging, and Alzheimer's disease. And as Marita mentioned, I'm going to talk about those things that happen to all of us as we get older with our memory, and how we understand those and how we differentiate those from things we should be more concerned about. And I'll talk a little bit about Alzheimer's disease and what are some of the typical findings there. And at the end, I'll say a few things about what we might do to try to keep our memories as sharp as we can. And I'll try to get all of this done in within an hour, and hopefully a little less, so there's time for questions, but I'll be glad to stay as long as it takes for questions afterwards. Now, I thought I would begin with the hard part. Well, first of all, before I do this, were handouts on these chairs up here. The one is a copy of these slides, or most of them. One is something that is from the National Institute on Aging about can Alzheimer's be prevented, and that will cover some of the things I'm going to be talking about. And another is a sheet that looks like it's where you can fill in some blanks, and if you are interested, and I emphasize only if you're interested in doing this, you can write your name and the other identifying information there. And if you'd like to get on the mailing list for this new organization we have going up in the Upper Valley, the Upper Valley Alzheimer's Disease Resource Center, we'll be glad to put you on the mailing list. And as soon as we have something to mail out, we'll mail it to you. This is a brand new organization that was started just at the beginning of this year. And we had an event in the spring, and we are having another event this coming fall at the end of October, October 28th. And I sent around separately from what's on the chairs a flyer about that program. Did everybody get a copy of that? Okay, so that if you're interested in that, that information is coming around. Now, On the other forms that you filled out, if you'll notice, on one side there's name and address and so forth, and on the back there's a series of questions that really ask for a self-assessment about memory. Yeah, that's the thing right there. And again, if you're interested in having us evaluate you for your memory or want to fill that out just to see how you're ranking on these various questions around memory, go ahead and do it. And you can either keep it for your own interest or you can give it to me if you'd like to do that. But I thought what we would do to begin is to give everybody a memory test here. So I hope you all have your wits sharpened and along with a sharp pencil. And what I'm about to do is show you a list of 10 words. I want you to study that list of 10 words, but don't write it down. That would be cheating. And then burn those words into your brain. And later on, I'm going to ask you to try to bring them back. Here's the words. I'll give you a few minutes to take a look at those. How are we doing? Does everybody have all of those words memorized by now? Another 30 seconds. I've done this many times. Only one person has gotten them all. Just don't worry. And I'm not telling how many I get. All right? Okay. Now, all of us, as I look around this room, all of us are past our prime when it comes to memory and cognitive abilities. Some of us are a little further along than others. But the fact is that we are cognitively at our best around the age of early 20s, when we'd be in college, which is handy since we're in college at that time. Hard to imagine that's always when we're at our sharpest, but at least sober, college students are the sharpest of all of us. And things begin to decline for most people to some degree or other, really from the early adulthood on, in terms of the ability to remember and to think sharply. Now that doesn't include everyone, and there's obviously a great deal that experience teaches us that is far more valuable than simply being able to use your brain sharply as you could when you're in college. For example, this woman, Jeanne Calment, she died in 1997 at the ripe old age of 122. She was completely, have people heard of her? She was the oldest known person for a very long time until she passed away, and she was completely cognitively intact when she died. Apparently, she couldn't hear or see well, but she thought very well. She was French, and so part of her secret for old age was drinking port wine. When she was in her, I think, 70s, I don't remember the exact details of this, she was getting on in years, and she figured she better plan for her future. So she had a piece of property in Paris, an apartment or something, and she made a deal with a person who purchased the property, and with the understanding that she would receive a certain amount of money per month, but she could remain in it until she died. And the lawyer who bought this, and I'm always pleased to say it was a lawyer, but The person who bought this thought he was getting a good deal. She was up in her 70s and figured he'd have this piece of property. She lived another almost 50 years beyond that. In fact, the person who bought it died of old age before she did and never got to move in, and there was a minor court battle whether or not his estate had to keep paying her, which it did, and then she died shortly thereafter. And not everyone loses cognitive faculties as they age. This woman is currently the oldest known person alive in the world. There may be others where it isn't recorded. I can't pronounce her name. She's Dutch, but she's referred to as Aunt Henny. And she's 115 right now and is apparently pretty sharp. Her philosophy about living is a little more simple than simply port wine. She just says, take one breath after the other. That was what she was quoted as saying, and certainly good advice. This woman, in 1937, when this Life magazine cover came out, was 100 years old and apparently was completely cognitively intact. Perhaps it was her cigarette that did that. I don't know. Hope not. But so not everybody loses as they get older, but for most of us, some of our memory declines with age. In fact, 50 to 60% of all people 50 and over have some degree of memory loss. So you're in the majority if you feel your memory isn't as good as it once was. I have this in my bumper sticker in my office, getting old is not for sissies. But I do want to emphasize, and hopefully we'll be getting to this, that we're talking about annoying and noticeable memory problems, but we're not talking about serious impairments in day-to-day functioning. When that happens, that's abnormal at any age. Whether you're in your 60s or 115 or whatever age, it's abnormal. It may be common, but it's abnormal and needs to be investigated. These are some older folks. Did I leave my keys in the car? Did I take my pills? Did I change my underwear? Did I eat my prunes? I mean, how many of us are thinking these thoughts once a day or so? What are the things that happen as we age? Well, there's a list of them, and we'll run through them. One of the most common things is that simply our ability to think rapidly declines. The speed of thought slows down. Think of the analogy of a brand new iMac from Apple, a brand new computer, versus a good old computer from the early days of the computers. They run at different speeds. Or think about, a new Porsche racing car versus an old Bug. They run at different speeds, and our brains run at different speeds. The older they are, the slower they tend to operate. Doesn't mean they don't operate well, and we may still love that old Bug or that old computer, but they don't run as fast as the younger ones do. One of the other things that we have trouble doing is doing more than one thing at a time. We can't multitask. We need to focus our attention more on one thing at a time. We can't literally walk and chew gum at the same time, many of us. And we try, of course, but we have more trouble. And this accounts for why, for many people as they age, driving becomes more of an issue, because driving absolutely requires that you do multiple things at a time. That you're looking here, you're also looking over here, and you're paying attention to many different stimuli all at once and needing to process them. And thankfully, because most people who are aged who still drive have been driving for many decades, it's very well ingrained. But it still is a problem, and older individuals have a higher rate of accidents for many reasons, but including because they simply can't focus on more than one task at a time as well as they once did. Other things that happen normally, and all of these things I'm describing now are normal changes with aging. We have less, and this is similar to what I just said about multitasking, we have less ability to focus our attention. We have to work harder to keep a laser focus on something. We're more distracted. We can't really pay good attention to two things at once, but we're very distracted by extraneous stimuli. So more distracted. More difficulty telling what's relevant information from what's not relevant information, so that it's harder to see the forest for the trees, typically with aging. And for all of these reasons, things we do take longer, and we may perform them with somewhat less accuracy than we did earlier in our lives. We have less what is called working memory. And think of this as, to keep up that computer analogy, that's the RAM in your computer. That's what you can remember in your head at any given moment. Working memory, it's called, because it's stuff you have to work with. Think of when you need to call someone on the phone. You don't know their number, and you don't have a pencil handy, so you call information, directory assistance. And they tell you, and you're in a payphone, as if you can find a payphone anymore, but just think of this situation. You call information, you get the number, they tell you the 7 digits or 10 digits that you need to call, and from the time you hang up the phone, put your 25 cents or 50 cents in and redial the number, what's the chances that you remember all 10 digits? That's working memory. Now, the phone company has figured out that people aren't very good at that, so for an extra whatever, they'll dial it for you. But that's the kind of thing. What can you keep in your head at any given moment? Working memory. We have less of it as we age. This is Superman in his later years. Dang, now where was I going? He says to his wife as he's heading out the window. And as Marita indicated, how often we're sort of going someplace and we can't quite remember where. This is a poem from Robert Frost, another sometime Vermonter. An old man's winter night. All out of doors looked darkly in at him through the thin frost, almost in separate stars, that gathers on the pane in empty rooms. What kept his eyes from giving back the gaze was the lamp tilted near them in his head. What kept him from remembering was what it was that brought him to the creaking room was age. So even Robert Frost, 1920, was very aware of this. It's a phenomenon that happens with aging. If you read analyses of this poem, I read something about this, and whoever was writing the analysis was obviously a young person because they described the man was so old he couldn't even remember what he went from one room to the other. That is somebody under 60 who wrote that, because all of us who are pushing 60 or over it know well that it's very common to go from one room to the next and not know why you're there. At our age, these are all cards, like greeting cards, birthday cards. People who know I'm interested in this, they always send me these things for my birthday, and sometimes they're funny, and sometimes I take them too seriously. At our age, you realize something very important. Then, poof, it's gone, and you can't remember what the heck you were just thinking about. And happy birthday, it says inside. Another thing that happens, and perhaps the most common thing that happens to us as we are aging, is we have more and more difficulty thinking of names and of words in general, but in particular nouns, proper nouns, words that begin with a capital letter. It's on the tip of my tongue. And there are many reasons for this. I'm not going to go into that now, but of course, this is something that happens to anyone at any age. You know someone very well, but their name doesn't come to you. As we age, it happens more and more and more. Says, hi, you'll have to forgive me, I'm terrible with names. Well, if you can't remember your own name, this is something beyond what we're talking about now, but how many of us have certainly met people at parties and you have no idea 5 minutes later after you've been introduced what that person's name is? This is a t-shirt somebody gave me. If I could remember your name, I'd ask you where I left my keys. Now, in addition simply to aging, there are a number of things that can affect memory that I want to mention and want you to be aware of. One of these is certainly depression. It's not uncommon as people age that their mood may become impaired, may become lowered, they may become depressed for whatever reason. And as people of any age, but particularly older individuals, become depressed, they don't remember as well. And sometimes we worry that means they're getting Alzheimer's, but if we look carefully, it may simply be depression. Anxiety, worry, anything that makes you kind of bite your nails can interfere, and it's really just a matter of being distracted and your emotional energy being tied up with something else so that you're not recalling as well. Stress. And doing too much. Here's a woman who's trying to drive, put on her makeup, eat, talk on the phone. How many of us see this? And I've seen those bumper stickers that say, don't talk, just drive, and things like that. Doing too many things at once, whether you're in the car or whatever, overloads you and you don't remember well at all. There are many medical problems which are increasingly common, unfortunately, as people age, that can also lead to difficulties with memory. And I've just listed a number of them here just to show you some of the very common things. Heart failure, breathing difficulties like emphysema, diabetes, stroke, a variety of conditions. Now, I mentioned in the bottom here, hearing difficulty and poor vision. Those things don't necessarily they don't at all cause memory problems, but they can be mistaken for memory problems, and it is certainly very common as people age that their vision isn't as good and their hearing isn't as good, and if it isn't getting in the first place, it won't be coming out. And so people who may seem like they're forgetful, and spouses may complain, he doesn't remember anything I tell him. But if you ask the individual, he may not be hearing half of what's been said. So very important, particularly if there is any degree of memory difficulty, to do whatever is possible to help someone hear well and see well. Very important to get the stimuli in, to get the input in, and then it's the brain's job to try to hold on to it. But if it's not getting in, the brain isn't going to be able to do much about it. And there's a long list of medications that can also affect memory. Just today I was talking with someone who has very mild Alzheimer's disease, and this is a person who has some difficulty sleeping, and she was taking Tylenol PM. Now, Tylenol PM works great for many people, but it's Tylenol plus Benadryl. Well, it turns out that Benadryl actually can impair your memory. If you have memory problems, if you don't have memory problems, it may not be a problem. But if you do, it can certainly make it worse. And there's a whole list of things that are both prescription drugs as well as some over-the-counter things that are maybe very necessary, maybe very serious. Some of them are very benign over-the-counter drugs, but a whole list of medications that have the potential for interfering with memory. And this is something to consider for anyone who is struggling with their memory. One of the first things we do in our clinic is to look at the list of medications that people are on. And that doesn't mean we can automatically take people off valuable, important, life-saving medicines, perhaps, but we need to know whether the medications themselves could be contributing to the problem, and indeed they may be. This is just a partial list. It's really all that fits on the slide, and there's many others. The word here is not to try to figure out yourself whether the drugs are creating the problem, but to be aware that any pill you take has the potential to be contributing to the problem, and it's something to discuss with your doctor. And don't be fooled by thinking that, well, it's over the counter, I didn't need a prescription, so it can't be harmful. That's not the case. Now, when should we be concerned? When all of the things that I've talked about up till now are largely, as I said, things that happen to most of us as we get older. When should we be especially concerned? Well, first of all, I would say that if you are concerned, that itself warrants talking to your healthcare provider about it. Perhaps that person will be able to reassure you, but no matter what, if you have concern, you should you should address it. Certainly, though, when memory problems seem to begin suddenly, in other words, today your thinking is just fine, but you wake up tomorrow and you can't remember a thing, something serious has happened and that needs to be investigated. When memory problems interfere with daily functioning or problem solving, when people really have trouble doing their day-to-day tasks or figuring out simple things like if it's starting to rain, it's a good idea to close the window. That's sort of basic problem solving. If that's not happening, it warrants investigation. When memory problems are associated with significant personality changes or changes in behavior, disturbances in behavior or distress, all of these things warrant investigation, or simply when the memory problems seem unusually severe or rapidly progressive, as I said up here. All of these things really mean you need to get it checked out. But if there's any concern, that alone is enough of a reason to go and talk to your healthcare provider about it. Well, this says here, more coffee, honey? He's thinking, who is that? Now, if that happens, clearly there's a problem, assuming this is actually his wife and not somebody he met last night. But this is a sign that you need to get some help. See your doctor. Ideally, and this is getting harder and harder these days with managed care and the way healthcare is changing, you go to the doctor, every time you go, you see somebody different. The ideal thing is a doctor who knows you well, who's known you over the years, and who has known how you think and how you function and can see the changes. It's much harder for someone who's never seen you before. It's not impossible if they're attentive to it, but it certainly helps if it's a doctor who's known you, takes the concerns seriously, and either performs some kind of an evaluation or refers you to some specialist somewhere. Doctors who say, well, you say you can't remember? Well, you're old, that's the way it goes. That's the wrong doctor. That doctor simply isn't informed. Yes, some memory problems are very common with aging, but if it's enough for you to go and ask about it, it warrants more than just being dismissed by, what do you expect, you're getting older. Now, time for the test. What are those 10 words? I'll give you a few minutes to come up with them. Think. No looking on your neighbor's paper. Forget we're in school here. What? It won't do you any good. Then you're sitting in the wrong seat. Need more time? Yeah. Okay, take your time. Sometimes when I ask that, people say, no, more time isn't going to help. How are we doing? Want a few more minutes, a few more moments, or are we, everybody ready to look and groan? Here they are. If you got more than half or more, 5 or more, you're doing great. It's abnormal to get a lot more than that. It's not unheard of, But in this context, and let me emphasize, this is a screening test. It happens to be one of the very best, the ability to remember a word list. But it's only one screening measure. And if you didn't do well on it, it doesn't mean you have Alzheimer's. If you did very well on it, it doesn't mean you don't have Alzheimer's necessarily. But it's overall a good general guide. And as this test comes from a book that I'll show you a little later on when we're getting ready to stop. As I said, no single brief test makes the diagnosis, but it's a good indicator. And let me go on. Well, before we went back to the test, I was talking about the things to be concerned about. And what these days people have on the tip of their tongue so often is it Alzheimer's? For many older individuals, Alzheimer's has become a word that people have as much fear about as people had about cancer, a decade ago and more. And it is something that is on everyone's mind. And there's a lot of it out there, and that's part of the reason. Right now in the United States, there are some 4.5 million people with Alzheimer's disease. Here in Vermont, it's more than 10,000, little tiny Vermont, the smallest population, or about the smallest population in the country, 10,000 people or more. And it's predicted as our population ages, there are more and more older individuals. And as we baby boomers reach into our mid-60s, there will be an explosion in the numbers of people with this disease unless we find some cure. So that by the middle of this century, if we haven't found a cure or a prevention for this disease, there'll be some 15 million people who suffer from Alzheimer's disease. And as I said, that is all a factor of age. Age is the greatest risk factor by far for Alzheimer's disease. At age 65, only about 2% of the population has Alzheimer's disease. A small percentage at 65. But as you go up every 5 years, it about doubles, so that by the mid-80s, more than a third of the population can be diagnosed. And there's controversy about whether this continues to go up or levels off as people get into the very aged years, over 90. But whatever the exact statistics are, from the time you're in your mid-60s through the rest of your life, the incidence increases, the risk goes up. Age is the greatest risk factor by far. Now, what are some of the symptoms? I don't want to spend a lot of time. I could spend too much time going into all the details about Alzheimer's, but I thought I'd just give you a bit of a quick overview about what it looks like. And this is an ad from one of the medical journals for one of the drugs to treat Alzheimer's from a few years ago. It's dramatic, but it's accurate. It says, all that she was, all that she is, unraveled by Alzheimer's disease. It's useful to think of the ABCs of Alzheimer's. People talk about that, and I take the liberty of adding a D to that. The A's being activities, what people can do. B is behavior, how they act and their emotional and psychiatric conditions. C is cognition, which is memory and thinking. And all of that leads to very often a huge D, a huge drain on the caregiver. So it's helpful to think of the ABCDs of Alzheimer's disease. We think of activities, we think of things that are in the earlier stages of the disease more likely to be lost, such as what are called instrumental activities of daily living. And that includes shopping, cooking, managing finances, driving, handling your checkbook, those kinds of things. And as the disease progresses, and this is a progressive condition, things can become more difficult for basic functioning such as the so-called activities of daily living, like dressing, eating, toileting, and ambulation. Now, this can take a variable amount of time from the time of diagnosis till things get very, very impaired, but it's typically 5 to 10 years from the time of diagnosis until someone dies with Alzheimer's disease. That's very variable, however. A is activities, as I said. B, behavior. Up to 90% of people with Alzheimer's disease have one or more significant mood or behavioral symptom at some point during the course of the illness. Not all the time, but at some point during the course of their illness, whether that's depression or apathy or anxiety or delusions, hallucinations. These types of symptoms are extraordinarily common throughout the illness. Early on, for example, apathy is one of the most common symptoms of the disease, where people really become very passive, not interested in doing anything. They're not unhappy, they're just content to be very inactive. Later on in the disease, agitation becomes the most common behavioral symptom, occurring in more than a third of patients, according to some studies. So at some point during the course of the illness, people typically have some behavioral issues that need to be addressed. Now, cognition is the C, activities, behavior, cognition, and cognition simply refers to memory and thinking. And typically the most common early symptom, really the most common symptom throughout the disease, is short-term memory problems. People often have no trouble recalling things that happened years ago in their life, but they can't remember what they had for lunch today. They can't remember yesterday or last week. Recent memory is what's typically affected. Late in the disease, long-term memory can be affected, but until fairly late, people are still able to tell stories from their youth or from their young adulthood that are accurate if you talk to their family. Language problems occur so that people not only have trouble with an occasional noun or name, but have more and more difficulty with language so that communication can become very impaired. People may have difficulty recognizing familiar places or people in their life. They may even be at home and say, I want to go home, because they're not able to recognize where they are as home. They may, as the disease progresses late into the disease, not even recognize a loved one who they've known for decades. That's a very traumatic experience, understandably, for people. And there may be some what is called executive dysfunction or problems with social judgment and a sense of social appropriateness. Those are hallmark symptoms of the disease. So that people do things or say things that they never would have done or said before they became impaired. And all of this, as I said, leads to an enormous drain on the family. And remember, people with Alzheimer's are at home for years. 70% at any point in time, 70% of those 4 or 5 million Americans who have Alzheimer's disease are living at home with a relative, with a loved one. Some of them are living alone, very few, but some are. Mostly they're living with family members, spouses who are caring for them, adult children, some other relative or someone. And their illness creates an enormous drain on the caregiver. And one of the most important tools in treating the disease, we believe, is supporting and educating the caregiver. And that's why we really encourage people to go to support groups. It's why we are doing things like our memory fair, the health fair that is on that flyer that's going around, and offering information about the disease. Information and knowledge about the disease is a very, very important tool that helps the caregiver cope. There's no cure for Alzheimer's yet, but a great deal of research is going on, an enormous amount of research. Aside from the tragedy of this field, in one level it's a tragic field because it's an incurable disease. Another level, it's a very exciting field because there's a host of very exciting research going on that's really on the cutting edge with new technology, working with the genome, working with sophisticated diagnostic and therapeutic techniques. So it's very exciting. There's a tremendous amount of research that's going on, although we don't have a cure. There may be a number of things that people can do, beginning in midlife, but it's never too late to start, which may help keep their mind sharp, that may lessen the chance of developing Alzheimer's. And I'd like to go through those now for you. Let me give you a dozen pointers to keep your mind sharp. And let me emphasize that all of these things that I'm about to discuss, no single one of them, not all of them put together, will completely allow you to avoid this disease. But they may help slow it down, they may help delay when it develops, and they're good general bits of advice anyway. And there is increasing evidence that these various things I'm about to talk about seem to make a difference. And I encourage all of you to take them seriously. Number one, watch your numbers. One of the things that we've learned in the last couple of years, is that some of the very common illnesses that happen to older individuals, happen to people at any age, but increasingly with age, such as hypertension, high blood pressure, diabetes, that these, high cholesterol, that these things, not only are they bad in and of themselves for you, but they are associated with a higher risk of getting Alzheimer's disease. High blood pressure, high cholesterol, diabetes, all of them associated with a higher risk of getting Alzheimer's disease. So watch your numbers. Keep your blood pressure down. If your cholesterol, stay away from Big Macs as much as possible. If your cholesterol is high and your doctor says you should be on cholesterol medications, you probably should take them. Watch your blood sugar. These are just good general medical advice, but bits of advice, but all of these things are associated, these diseases, with an increased risk of getting Alzheimer's, along with everything else that they cause. Eat wisely. Fruits and vegetables with large amounts of antioxidants, low-fat, low-cholesterol diets. Here's a few recommendations. And here's a list. This is in your handout of the best sources of antioxidants. And just last week, and that's why this isn't in your handout, there was something that came across in the news that said the best source of all for antioxidants isn't, blueberries and all this healthy stuff. It's coffee. It's coffee. So that's added on here, but it's a late edition after the handout was printed up. It made me very happy because I can't stand broccoli, but I love coffee. So I'm going to live forever. But this is a list, and there's lots of things that you can read out there, and including in the other handout from the National Institute on Aging that gives some advice about diet. Keep your weight down. There's been a number of interesting studies that show that people who are significantly obese in midlife have a much higher incidence of getting Alzheimer's when they get old. Aside from the fact that it makes you higher risk for diabetes and hypertension and all of that, it increases your risk of Alzheimer's. The other thing I would say is if you are this overweight, keep your clothes on. This is a picture that was emailed to me with a comment. This is man, you can see he's on his computer here. And it says, why you shouldn't let your daughter go into internet chat rooms. Don't smoke. Years ago, there was some uncertainty about this, and it was actually thought that smoking, because of the nicotine in the cigarettes, may in fact lessen the risk of getting Alzheimer's. We now know that's certainly not true, and that smoking, adding to the list of the many, many things that smoking can do to you, it can increase your risk for getting Alzheimer's. You won't get Alzheimer's if the cigarettes themselves kill you, as they did this man in his 50s. This is Humphrey Bogart, who died of, I believe, throat cancer or lung cancer in his 50s. So chances are you won't get it. But if you want to live longer and lower your risk for Alzheimer's, put out the cigarette. Alcohol. If this is what you have before dinner every night, you're drinking too much. Moderation is appropriate. One, possibly, if you're a female, 1 glass of wine, mixed drink, or beer, 1. Males, maybe a little more, 2, not 3 or 4 or 10, but 2. May be associated with some general good health factors, but certainly excessive alcohol is associated with many illnesses, obviously, including dementia. Protect your head. There have been very interesting studies that show that people who suffer significant head injuries with loss of consciousness at any point in life actually have a higher risk of developing Alzheimer's disease. The mechanism of that isn't totally known. There are some theories, but it's been shown, for example, in a very interesting study of World War II veterans, all of whom were in combat, all of whom saw action. This was a study that was done in a VA setting a number of years ago, where they looked at vets who were still living in the VA system and took a group who had no head injury in the war, and a group that had mild head injury and a group that had severe head injury, and I can't tell you exactly how they divided those up, but severe head injury always is associated with loss of consciousness and a concussion type of thing. And they found that those vets who now almost, well, it was more than 50 years earlier than this study when it was published, those vets who'd had significant head injuries had a higher incidence of having Alzheimer's disease. And this is something we can't totally prevent, but certainly we can do something about. Wear a helmet. Exercise. Exercise is good general advice for anyone if it's appropriate for you in terms of your physical condition. Some sort of exercise undoubtedly is. This is something you need to discuss with your doctor. But there are multiple studies that show that people who exercise in midlife and late life have less stress, a better frame of mind, better health generally, and are better, sharper cognitively. Remain cognitively engaged. Keep your mind active, or as they say, use it or lose it. So those of you who are here today and going to lectures and keeping yourself active in that way, or working crossword puzzles, or playing a musical instrument, using the computer, just reading, anything that keeps your mind active has been shown to be associated with a lower risk of developing Alzheimer's years later. Now, some of that data is a little hard to interpret, quite frankly, because we know that if someone is diagnosed today at, say, 75 with Alzheimer's, that disease has been coming on in a very gradual way for many, many years, and those individuals may have been less likely to want to read and keep their mind active anyway because they were on the way to Alzheimer's. But there also seems to be data that suggests that whether you're on the way or not, if you keep your mind active, you may delay it, you may help keep your brain sharp longer, whether you get Alzheimer's or not. And of course, it's good general advice. How can anyone argue with it? Same thing for staying socially connected. Studies have shown that people who are very socially isolated as elders have a higher risk of Alzheimer's than those who stay stay socially active throughout their life. Keep happy and manage stress well. Well, easier said than done, and all of us have stress in our lives, but if you're really burdened with sadness, with stress, with problems, get them dealt with for many, many reasons, including there are very recent studies that have shown that people who are burdened with a lot of stress and depression have a much higher incidence of developing Alzheimer's disease. Chronic, unmanaged stress or poorly managed stress probably leads to nerve cell death and increases the chance of developing Alzheimer's disease. Organized, prioritized. Get things together in your mind. It's like figure out what you need to do, write it down, buy a Palm Pilot if you're into electronics, decide what you need to remember, and the rest of it, forget about it. It's like every now and then you need to clean out your attic. This is cleaning out your mental attic, and people need to do this. If you're on 10 different committees in your community, that's wonderful that you're staying socially active and all of that. But if you're having to remember too much, unload some of it. Make life a little easier for yourself. Focus your attention, and remember, all of us as we age do less well with this. It's harder, and you need to work at it. And I've had older people tell me, people intact cognitively, say when they drive, for example, they no longer can have a conversation in the car with somebody, they no longer can listen to the radio. They need all of their attention focused on the road in order to stay safe as a driver. Well, that's a wise person who's doing that. Too many of the rest of us probably should do that and don't. But focus your attention. Associate. Keep mental images. If you meet somebody whose name is Mr. Stone and you're trying to remember their name, make a mental image. Visualize that person as a stone. There's a chance you'll call him Mr. Rock when you see him, but there's a good chance you'll get it right. And repeat. It's like with the phone number I said before, or directions. You're trying to keep something in mind, say it over and over again. I find this with when I'm trying to find my way to someplace and I don't have directions, I stop and ask, and they say, go 3 blocks and turn left and then go right at the top of the hill. I'm saying to myself, 3 blocks, turn left, go right at the top of the hill. 3 blocks, turn left, go right at the top of the hill. 3 blocks, over and over again. It'll help keep it in mind. So there's a variety of these techniques that people can use to try to sharpen their memory. And in a second, I'm going to show you some books that may give you lots of pointers about that if that's something you're particularly interested in working on. The Alzheimer's Association has a program called Maintain Your Brain, and it addresses many of the kinds of things I've been talking about here. They can be seen on the internet at this website address. And there are materials in the booth. The Alzheimer's Association of Vermont and New Hampshire will have a display and lots of information at our Memory Health Fair coming up in late October. It's on that flyer I was sending around. And there's a number of books. This is the one that was passed out. Can Alzheimer's disease be prevented? And it's a nice little booklet, and a lot of what I've said that covers many of the same kinds of things. That's in that handout that you received. No matter how good you are about this, you do everything I've said, you work hard at it, like this guy, less cholesterol, regular checkups, no nicotine, no alcohol, low sodium, moderate exercise, no sugar. If it's going to happen to you right now, it's going to happen to you. You can't, no matter how hard you work at it, you can't totally prevent Alzheimer's. But you may be able to delay it, you may be able to slow it down, you may be able to make it a little less likely that it's going to hit you at the prime of your life by doing some of the things we talked about. This is a selection. Clearly you can't read all of these, but they're in the handout, and hopefully it's big enough print to read. There's a great deal of information out there, including on the internet, about Alzheimer's disease. This is a listing of useful websites. And there's a bunch of books that I would also suggest if people want more information about this. This first one, and these are in the handouts as well as and there's a print, it's printed out, the title and the author, and if you have any trouble getting hold of these, you can check with a library or any bookstore, and certainly on the internet on Amazon.com, they're all readily available. This is the Memory Bible by Gary Small. The memory test we did at the beginning of this presentation is from this book. Those 10 words. The concept of the 10-word list is from a neuropsychological test called the California Verbal Learning Test. But those, and the particular words that I used are not on that test, but they are the words from Gary Small's book. There are words that don't fit together easily. They're harder to remember that way. But if you want to read more about that, and many other good bits of advice about maintaining memory, they're in this book. He has another book called The Memory Prescription. Gary Small is a geriatric psychiatrist very involved in Alzheimer's research and treatment out in UCLA in California. And his books are very readable. This is something called the Memory Workbook. This is a lot of exercises that are very helpful and are, some of which are obvious, and it's kind of, well, I didn't need a book to tell me to do that, but some of it's very, very helpful, and it's worth taking a look at. This is another book called The Memory Cure by Dr. Fatui. He's from Johns Hopkins. How to Protect Your Brain Against Memory Loss and Alzheimer's Disease. Keep Your Brain Young by Marilyn Albert and Guy McCann. And this is something from Harvard Medical School that is very, very nice, and it's relatively short. It's about 40 pages. It's a booklet type of thing. Improving Memory, Understanding and Preventing Age-Related Memory Loss. And that's something you can't really find in a bookstore, but you can certainly find it by, or get hold of it by calling them or writing to them, or it's on the website, and I think the information is in the handout about that. So I'm happy to take comments and questions if you have them at this point. I do want to again mention this memory fair we have upcoming in the fall. I hope it's something that you'll think about attending if you have more interest in this topic. The Memory Health Fair will be lots of people around with lots of information wanting to share it with you, and we did this in the spring. People found it very, very helpful. Then there'll be a lecture, there's some food, and then there's this wonderful play called Norman and Beatrice, which was written by Barbara Hammond, whose father had dementia, he's no longer living. And she's a playwright in New York City, and it's based on her letters and emails from her mother, who is Beatrice, who took care of her husband until he died, and she would describe in detail their conversations and what happened, and Barbara saved up all these things and put them into this play, and it's a very moving and very realistic account of living with someone who has dementia, and it's really a love story. And it's a wonderful play. We'll be doing a staged reading of it on October 28th, and I would certainly encourage people to think about coming up for it. It's a wonderful jumping off point for conversation. So I'll stop at that point, but as I said, I'm happy to take comments and questions if you have them. Yes, Bess will put the lights on. Thank you.
I have 2 questions.
Go ahead.
And I thought I had heard that you couldn't determine if it's Alzheimer's until you did an examination of the brain tissue after your death.
Well, it's a very good question, and I'm glad you brought up that point. First of all, is Alzheimer's and dementia, are Alzheimer's and dementia the same thing? Alzheimer's disease is a type of dementia. Dementia is a broader category that includes dozens of different illnesses, most of which are very uncommon, only a few of which are common. And among the various dementias, Alzheimer's is by far and away the most common. Alzheimer's accounts by itself or in combination with other illnesses for well over half of all cases of dementia, perhaps as many as 80%. So if you know someone has dementia, statistically the chances are that it's Alzheimer's, but there's a host of other things that are much less likely that it could be. And there are many more similarities among the various dementias, at least in terms of how they present and the impact on the caregiver and so forth. There are more similarities than there are differences. There are differences in what causes it and so forth, but how the individual behaves is very similar from one dimension to the other. There are some exceptions, by and large that's true. As far as your question about being able to make an accurate diagnosis, it's true that you cannot make a diagnosis with 100% accuracy during life, but people who do this as a specialty interest and who have lots of experience with it can be more than 85% accurate, about 90% accurate with the diagnosis during life. And the things that we miss generally are things that are very similar to Alzheimer's and are treated the same way. So it's the myth that you can't tell it all until death is not true. Yes.
I've had two people tell me recently that they had multiple operations and therefore and it has affected their ability to remember things. Number one, is this true? And number two, will they, both of them, be more liable to be Alzheimer's patients?
Well, it's true that anyone who undergoes a serious operation, the stress of the operation, the physical stress on the body, as well as the emotional stress of being that sick, and the effect of anesthesia will, yes, those, but it's really both. Those things will certainly impact memory in many, if not the vast majority of individuals temporarily. Now, individuals who have an underlying memory disorder will have a more severe reaction to surgery and to anesthesia than would somebody else. And, for example, a younger, physically and mentally, cognitively healthy person who, let's say, gets a knee replacement. It's a major surgery. They may have a little bit of, liftiness. What day is today when they come out of surgery? They may even have a transient delirium for the couple of hours, but they're basically fine with themselves within a day or so. Someone who has an underlying cognitive disorder may undergo something like that and be quite confused for quite a while. May even become agitated or hallucinate and so forth, and may need some specific treatment right around the time of the event. Usually that goes away, if not entirely, mostly. But occasionally one sees that for people who have Alzheimer's disease, who undergo some kind of surgery, they get very confused after surgery, and even when it's all over, they get better, but they never quite go back to as good as they were. We always tend to tell people who have Alzheimer's, if you're thinking about elective surgery, don't think again. It may have an impact on your memory that won't be reversible. Does that answer your question?
Both of them have said that it's a long-term thing. One of them has affected her job, her ability to do her job.
Well, certainly there's also the possibility, of course, depending on the surgery, if things are complications, people can have complications during surgery with blood loss or low oxygen that can affect thinking considerably. But it all depends on the situation. Yes.
What are the latest findings about the relationships of genetics and the chances that you also will come down with Alzheimer's?
If Alzheimer's does, to some extent, have genetic components, so that if you have a parent or a sibling, in other words, a first-degree relative with the disease, your chances of having it are increased 2 to 4 times, about 2.5 times overall. Now, it varies depending on what age they were and you are and so forth, but overall, the incidence does go up. There are many, many people we see with Alzheimer's who have no relatives with it, and certainly there are people who have a parent or even 2 parents with Alzheimer's who manage to escape it. So it isn't 100% by any means. Genetics is something where there's a tremendous amount of work going on, and we're learning more and more about that now that we know about the genome. But there's a lot more to it. Yes.
Going back
surgical procedure and anesthesia, the use of Versed,
Do-
the use of Versed,
Oh.
which is
Versed.
Versed.
That's a type of, that's a drug that is used sometimes in anesthesia to actually induce some short-term memory loss. If somebody's going through a particularly unpleasant procedure, the last thing you want them to do is to remember, so they get Versed. It can be used in someone who has Alzheimer's, just as it can be used in anyone else. It may not be as necessary in someone with Alzheimer's. It doesn't cause permanent damage. But any anesthesia, any general anesthesia, as opposed to local anesthesia, has the potential to cause more cognitive problems. You may need it as a life-saving procedure, but be aware of that. Yes.
As you went along with these things of not to do and things to do, I kept having more and more of a feeling that what you were talking about is really what 2 or 3 generations ago was called common sense. That many of the things that we've been doing have been the result of the ability to do it or the pressures to do it. And maybe if we use the common sense that our ancestors had, we'll be able to cope with this.
I think you're absolutely right. It's unfortunate to think that we haven't used common sense for 2 or 3 generations, but you're absolutely right. Many of the bits of advice that I gave are uncertain whether they really will make a huge difference with Alzheimer's, but they are such generally good bits of advice that they are common sense. And translating that into action, and if you're particularly worried about it, making sure you do more, as many of them as you can, probably makes a difference. But you're right, it's mostly common sense. There's nothing very esoteric on that list. Yes.
But is it inevitable that people with Alzheimer's reach the point where they want to recognize their husband? That we had a dear friend that this happened to, and eventually, it's just
Over a period of about 5 years from the time they first recognized there was anything wrong with him, they didn't know it was Alzheimer's. This was a long time ago, but until he became virtually invention.
Well, the question for those who probably hear it is it inevitable that if you have Alzheimer's, you're going to ultimately progress to not recognizing your loved ones, not being able to eat, and so forth? And no, it is not inevitable. Every case is different. Those things that you mentioned and I just repeated are unfortunately common as the disease moves into the late stages, but they aren't inevitable. And it's part of what may make those things less likely to happen or happen later is getting treated for it. I haven't talked anything about treatment, that's another lecture, but certainly if someone has the disease that should be on medication because it makes those things, for example, not being able to recognize a loved one, less likely to happen, or it pushes it off into the future longer. If you live long enough with Alzheimer's, you're likely, in other words, you don't die of something else. And this is a disease that typically, the average person with Alzheimer's is about 80, so obviously people aren't living for decades after they have it on average, and they will have other illnesses which take them before the Alzheimer's does. But if you are lucky enough or unlucky enough, depending on how you look at it, to be a perfect specimen of health, and all that's wrong with you is Alzheimer's, and you live for years with your Alzheimer's, ultimately you're likely to lose almost all of your ability to think, to recognize familiar people and surroundings. And for many people, the latest stage of the illness is to lose the ability to swallow and to eat. Yes.
With regard to the treatment, and I don't want to get very specific about this, but from the diagnosis through the various stages of treatment, of the patient, because there are so many issues, the cognitive issues, but the medical issues as well as the behavioral and social issues. Do you think it's important to have a team approach, several doctors in your bag to help you through this, or is there one particular individual doctor that you think can get you through these certain stages?
It's a very good question. The question is it something that should be dealt with as a team approach, or can just one person do it? And the answer to that would be I don't know if you remember the book a number of years ago written by Hillary Clinton, It Takes a Village, about raising children. It takes a village to take care of someone with Alzheimer's disease too. Different village perhaps, but it takes a village. Some of those are doctors, a lot of those are not doctors, they're other healthcare people, they're people in the neighborhood, they're people in the community, they're family members. It takes lots of people to take care of someone with Alzheimer's disease. The more, the better, because then there's less burden on the primary caregiver, who so often is a spouse. But to specifically answer your question, which is really has to do with doctors, should there be one doctor or more than one doctor? That really varies, and it depends on if a number of things. If your doctor is knowledgeable and interested in, your primary care doctor, knowledgeable and interested in Alzheimer's disease and knows about treating it and is convinced about the importance of doing that, your primary care doctor may be all the doctors you need. On the other hand, if there are complications in terms of some behavioral challenges or some symptoms that are not easily explained, that could be neurologic problems that look like Alzheimer's but maybe something else, then perhaps a consultation or follow-up by somebody else, a neurologist, a geriatric psychiatrist, and so forth, might be necessary. What I would say is, people often ask me, who's the right doctor to treat someone with Alzheimer's? Is it a neurologist? Is it a primary care doctor? Is it a geriatrician? A psychiatrist? And I would say the right doctor is a doctor who knows about the disease. And the wrong doctor, no matter what their specialty is someone who isn't up on it and who thinks that losing your memory and getting extremely forgetful is just part of old age and you have to live with it. That's the wrong doctor. And it matters less whether the person is a neurologist or a psychiatrist or a geriatrician than that they are interested, that they have a sense of eagerness about treatment, and that they understand the importance of dealing with it over time. And that depends on the doctors. It's certainly easier to have fewer doctors than more. It isn't essential for every single person to have a neurologist or psychiatrist follow them. But it is essential to have a doctor who really knows what they're doing. It's a complicated illness, and it's something that needs to be managed by someone who knows about this. There's a lot of new developments in the field all the time. And something you really deserve to have somebody who's up on it. Yes, sir.
You have a list of various drugs that lead toward Alzheimer's. I didn't see lithium carbonate. Is that one of them or not?
Well, the list of drugs, first of all, let me emphasize that the list, I'm glad you brought it up, the list of drugs I showed up here, it's only a partial list, are drugs that can affect memory. They don't necessarily cause Alzheimer's, in fact, they don't. They can, as long as you're on the medication, fog up your memory. And typically when you go off that medication, your memory unfogs. So they don't necessarily cause Alzheimer's. There are no drugs that we know of that cause Alzheimer's, thankfully. We're sure we avoid them if they work. They work, but we don't know that. You mentioned lithium carbonate, and that's an interesting one. Lithium is used to treat a variety of things, but most commonly bipolar illness or manic depression. And lithium, when lithium levels are abnormal, in other words, people have too much lithium in their body because their dose needs to be adjusted, they can get very confused. On the other hand, there have been data recently that suggest that lithium actually may help keep neurons alive longer, and it may have some protective effect against developing Alzheimer's. So like many things in this field, it's intriguing and it isn't yet known, but it's being studied. But it is certainly not something by itself to be avoided if it's needed for other causes. It's a wonderful thing. Yes?
Would you say a word
The question is about our new organization, the Upper Valley Outreach. I think it was my first was the Upper Valley Alzheimer's Disease Resource Center. This is an all-volunteer, loosely knit group of people who are professionals in the field, family members, community members, who have an interest in this subject. And we're brand new, so asking a year, what are we doing, and it might be different than what we're doing now. But by and large, the main focus is to provide education and information and to help people be aware of the resources that do exist in our communities to assist with this disease. We don't provide treatment itself, or we can point people in that direction. It's for information, support, and education primarily. And in many ways similar to the Alzheimer's Association, although obviously it's a smaller, more local group that's focused on our immediate area and our resources here. And the health fair and the lecture and the play we're doing in the fall is a good example of the kinds of things. It gets the word out both about the disease, both to family members who are dealing with this, and helps them learn more about the disease, and there's lots of information which we give out at that time, from the things about the drugs to the new Medicare laws, to how to avoid falls, to how to find nursing homes, to all kinds of information like that, dealing with driving issues, as well as just getting members of the general community who may not be aware of this to know a little bit more about it. That's the kind of thing we do. Any other questions, or shall we? Yes, one there in front of the middle wrap.
A number of years ago, 20 years ago, I heard a talk on Hong Kong, and the person who was doing it ended up with a tagline, and it was oversimplification. He said, if you forget where you put your glasses, that's normal. If you forget to wear them, then you're okay.
That's a very good way to stop. And there are, just so to repeat it, people didn't hear it, if you forget where you put your glasses, that's normal. I'm glad to hear that, because I must have 15 pairs of glasses, only about 2 of which I know where they are at any given moment. The rest are somewhere, I think. But if you don't even remember that you wear glasses, then you're wrong. And people say if you can't find your car keys, that's fine, but if you don't even know how that you own a car, then you have a problem. And so much of this is a matter of degree. It's normal to be forgetful. It's normal to be more forgetful as you get older. It's normal to be forgetful as you're young. But it's how forgetful, how pervasive it is, how serious it is. And it's a matter of degree that gets us to either say, it's nothing to worry about, or to be concerned about. So on that note, why don't we stop? And thank you very much.